So this is an adult patient with known history of CA lung, and there is underlying clinical suspicion that there is possible metastasis in view of increasing headache as well as some neurological deficit. So I will take through all the sequences with you as an MRI to see how we can approach that, okay? So there is an SCOT1 weighted sequences. As you can see, the CSF are dark, while the fat and also the marrow, which contains some yellow marrow signal inside, can be seen, okay? So actually T1 weighted sequences is best used to be assessing the marrow signal. In case there is some, for example, bone metastasis, there can be some infiltration and you will expect to see some T1 hypointense signal because majority of bony metastasis contain some fluid inside and should be T1 hypointense, and loss of this kind of hyperintense marrow signal. And the cerebrum appears grossly okay on the T1 weighted sequences. However, you can see that there are some T1 weighted hypointensity, okay, on both cerebellar hemisphere, but more significant on the right side. So there should be something going on here, okay. So we can switch to T2 weighted sequence. Most of the time, T2 weighted sequence is quite effective for us to pick up some lesion because majority of the lesion contains an increased in fluid signal, okay. And just now, corresponding to the T1 hypointense area, we can see there is some T2 hyperintense signal. And apart from that, you can see that there are multiple nodules, which is seen as both the bilateral cerebellar hemisphere. Okay, so together with the edema, as well as the multiple intraaxial lesions, that means those lesions are within the parenchyma rather than as the extraaxial like the meninges, okay? So all these lesions, I try to circle it out, okay, are actually located as the gray-white matter junction. So what is the underlying suggestion, okay? So assuming that this is the gray matter, okay, and underneath it is the white matter, okay? No matter it's cerebellum or cerebrum, the concept is similar, okay? So you can apply that. So where is the blood supply coming from? It is at the sulcal spaces and also at CSF spaces. Overlying there is some vessel, and then there will be deep down into the brain parenchyma. Usually at the gray matter junction, there is a slightly more abrupt in reduction of the caliber of the vessels, okay, which is not just smoothly tapering as we expect. And then if there is a tumor emboli here, it will easily dislodge at the junction of the gray-white matter junction because of the sudden reduction in caliber. Okay, so this is the preferential site where the tumor emboli will accumulate. So you will expect to see hematogenous spread of pathology, not only metastasis. For example, bacteria causing brain abscesses, if this is hematogenous route, it will also favor similar position. Okay, and all of this T1 hyperintense and now T2 hyperintense signal are concentrated as the white matter, so suggesting that it is possible cerebral edema, more likely to be vasogenic edema. Okay, so we can take a look at the other scan. So we have also the T1 weighted sagittal plane sequences, which is also a great cut for us to all again appreciate the normal bone marrow signal. You will appreciate that the usual normal clivus and also the occipital bone is relatively lack in red marrow. So you appreciate that more bright. However, you can still see a little bit red marrow signal. Okay, just you may somehow think that's why the other bones are more hyperintense. Are they bone metastases? No, they are not, because you can still see interspersed yellow marrow within the normal red marrow. Okay, just its usual appearance. And you can appreciate that the cerebellum is having hypointense signal from the edema that we just see, okay? And then we can take a look at the post-contrast sequence. For the brain metastasis, they do not have the usual normal intact blood-brain barrier carrying with them. So they must be enhancing after we administer some contrast agent to the blood space, okay? So you can see all the lesions are actually enhancing. However, not only the so-called brain metastases are enhancing, we can appreciate something like curvilinear, something like this, okay? So what are they? They are the usual folia, okay? Sulci is used to describe the cleft at the cerebrum, while the CSF cleft at the cerebrum is called folia, okay? So you should not expect to see any enhancement usually because of the leptomeninges is only very thin and the PO vessels only minimally can be appreciated like here, okay, they are okay. However, you can see there's nodular enhancing thickening filling up majority of the folia of the cerebellum, okay. In fact, it is the location where it is most dependent and majority of the leptomeningeal metastases, the tumor cells, okay, are actually will tends to accumulate, okay. So there's a very high yield area. You can try to look for any leptomeningeal metastasis, especially this cut where most of the time we will only pay attention to the cerebrum, okay. However, do not miss out this most superior aspect of the cerebellum, where you will expect to see there is some enhancement here, and then you can appreciate that there is increasing nodular thickening also as the superior aspect here. And also this is another site there you can look for any nodular enhancement, which is the interpedicular cistern as well. And then you can eventually also take a look at the T2 weighted flare sequences, in which it is the same as T2 weighted sequence, but you also have attenuation of the normal CSF signal. So the pathology will be much easier to be appreciated as it more stand out, okay? So you can appreciate that, okay, majority of the T2 signal are actually like finger-like projections, which is occupying and also expanding the white matter. So they are fulfilling the concept of vasogenic edema. So actually, why vasogenic edema is tracking along the white matter? Because we know that the gray matter contains some closely packed cells, okay? Closely packed cells, neurons, okay, cell body, in which only a little bit amount of space is left between the cells where the fluid hardly can penetrate between them. However, for white matter, there are actually some white matter tracks, okay, where each tracks actually are less closely packed, in which the fluid can easily track through the interstitial space between those fibers, okay. Of course, there is some exceptional case. For example, corpus callosum is very densely packed white matter tracks, then the edema it can hardly penetrate through. So all of you, in this case, hope you can learn that how we can assess certain kinds of metastases. The two most classical one would be leptomeningeal and also hematogenous brain metastases. And also you can take a look at the marrow signal, which can also be useful sometimes to look for some bony metastases as well.